Hi, so today we'll be doing IV fluids and IV mini bag in 2 videos. I will start off with all of the equipment we will be needing for this procedure. So the supplies that we will need is going to be the IV solution. We will need both 500 ml of normal saline and a 50 ml bag for our antibiotic. We will also need the towel and the IV set itself. We will also need tubing for the primary and secondary bag. We need the command hooks, our patient and ID band. We need alcohol prep pads, normal saline flushes. We will need labels to label both our bags and our tubing. We will need our provider's orders. So we have gathered all our supplies. We will now be reviewing our provider's orders. Our provider's orders are for patient Ellen Davis. Her date of birth is 9/19/1963. She has no known allergies. The doctor ordering is Dr. Jones. Her diagnoses are CHF as well as pneumonia. Our orders are for today: 500 mLs of sodium chloride at 125 mLs an hour, as well as 50 mLs of Zephysolin, 1 gram, over 30 minutes. We will be reviewing our 6 rights: right drug, right dose, right time, right route, right patient, and right documentation. So the right patient is Ellen Davis, date of birth 9/19/1963. We will verify this with the patient before we administer the medication, as well as making sure that she does not have any allergies. The right drug will be the normal saline as well as the Cefazolin. The right dose, we will be administering 500 mLs of normal saline and 1 gram of Cefazolin in 50 mLs of fluid. The right time is now, today. The right route is IV. We will be administering these through IV infusions. The right patient is Ellen Davis. And the right documentation. Once we have completed our procedure, we need to ensure that we're documenting everything that we have done. We will write a nurse's note on how the patient tolerated the infusion and if there was any complications. So we will start with hand hygiene. Once that is done, we will start with our primary IV bag, which will be the 500 mLs of normal saline. So we will grab that as well as our primary IV tubing. So we have here 500 mLs of 0.9% sodium chloride, which is normal saline. We will be checking its expiration date. The expiration date's right there, and it's for January of 2023. We're looking at the bag, make sure that it's clear, there's no particles, and there's nothing inside the bag. Once we have that, we can go on to our IV tubing, as well as checking for the expiration date, and expiration is August 31st of 2023. So we both have our primary bag and tubing, and we will initiate priming. So we will start now to prime our primary line. We want to make sure that our roller clamp is closed. We need to make sure that we're using aseptic technique. We're grabbing our bag as well as our spikes. Make sure it's all the way in and that nothing touches the spike. So it's in. Now we can invert it. Squeeze fluid into the chamber. We're hanging our bag. Now we'll be priming our tubing. We want to make sure this is over a trash can. So whatever fluids, when we're priming, the little drops are falling somewhere. So you want to use gravity, kind of keeping it downwards. And then just slowly open your roller clamp. And it should start coming. Okay. Now you put your clamp back. Make sure it's closed. So we have primed our primary line. We will now hang this here and wait to administer this to the patient. We also always want to make sure that our IV bag itself has a label. So I have created a label with the patient's name, date of birth, type of medication, what's in it. This is just normal saline. It's 500 mLs. Also at the rate it's supposed to go at, the start and the end time, the date, and the initials. We will place that on the bag itself. And we also want to make a label for our IV tubing itself, usually just with your initials and date and time. So this is what your primary line should kind of look like when it's hung. So for this, we also want to calculate the drip rate for the 500 mLs of normal saline. And it will be 21 drops per minute.